And I think all of these things are happening, and it's almost like one of those things like you're either on the bus or you're not. I mean, this bus is going 100 miles an hour towards the digital age, and I think that as surgeons that provide higher level of care, we have to be on board with it. But I do think that, yeah, there's a lot of, like you're saying, Fabi, I think there's a lot, Dr. Fabi, there's a lot of doctor shopping. And we definitely, I pride myself on telling patients all the time, I go, listen, I agree, you need a total hip. But guess what? You're going to do it in our surgery center, where you're not going to have to go to a big hospital. And that aspect of it with COVID has just surged, because now nobody ever wants to go to hospital. They think that like they're going to walk in the hospital and die. So I think that it's like the whole COVID thing has made this business even better than it was, because it just continues to drive it. But I think that's one of the caveats, I think, in competition that you can provide. This is a private experience. You're away from the hospital. You get our anesthesiologist, our environment. There's no infections. Because, the bottom line is, like you were saying earlier, when you're in a hospital, there can be a pussed out, abscess in your room the night before, and then you're putting a fresh total joint in that room. So you just can't control a lot of these factors. And I think that as surgeons, these patients are not coming to the hospital. They're coming for us. They're coming because they want the surgeon. They want Dr. Fabi, Dr. Hansen to operate on them because of their reputation. And we're bringing these patients to the hospital with our reputation. And I think it's about time we take our reputation back and get some value from that. And I think that's very important.